Here's my portfolio presentation. This is the front page, the front cover. This is the side spine with my name. Here's my table of contents, divided into the 6 sections. Here's my resume, cover letter, professional mission statement, placeholder for professional letter of recommendation, my character letter of recommendation, my academic letter of recommendation. Here's an example of an elevator speech. So what I have written is, thank you for taking the time to speak with me today. My name is Natalie Cunningham, and I'm actively dedicating my life to help others with their mental health and other needs. I've experienced mentoring, encouraging, and teaching others. The substance use disorder counselor and group facilitator position on your website caught my eye. What are some different opportunities within this agency? And of course, I would change that depending on where I was applying. Here's my unofficial transcript, and the other side, my certificate of completion for the Preventing Adverse Childhood Experiences Continuing Education, mandated reporter online training, ethical standards, here's my acknowledgement of Castle Branch requirements, personal values and awareness assessment. Here's my self-care plan. The other side of it. Here's my final research paper from Understanding Addiction. This paper talks about, it gives education on drugs, how they're used for abuse. So it matches the criteria for providing education relevant to substance use. There's also different street names on the commonly abused drugs, what they do to your body and your brain. Introduction to Diversity Studies. It's culture, but all about different cultures. Here is my Introduction to Counseling transcript. So here I have what we said, the skills I used, and what I did well or what I could improve on. And this matches the criteria for adhere to accepted culturally competent ethical and behavioral conduct, because I'm establishing professional codes of ethics, federal and state laws, agency policies. I'm utilizing effective strategies to maintain my own health. I have a reflection at the end. Here's my final journal reflection paper for Introduction to Substance Use Counseling. Substance Use Disorder Counseling. Talks about the personal journey, different skills, how I'm going to use them in the future. Here's my informational interview that I did with Tommy Home, that is in Wittenberg. Here's another final reflection paper. This one is for another substance class. My references, my personal manifesto for service learning. So this is different things that I see wrong in our society and how they could be changed, or how I could work towards changing them. Here's a case file, which shows that I know how to diagnose using the roadmap to diagnosis. Here's my DSM-5 diagnosis for Gwen in 28 days. This shows that I meet the criteria for clinically evaluate for substance use disorders and treatment needs. So in the paper I go through what her diagnosis is based on the criteria, the DSM-5. Here is my transcript from a group counseling. This shows that I demonstrate counseling skills with individuals, groups, and families. So it's set up like the individual counseling one, what we said, the skills I used and how I could improve or what I did well. Here's my substance use disorder treatment plan for Gwen in 28 days. This shows that I meet the criteria to develop treatment plans. And then here is the DAP note for Gwen. So this shows that I maintain clinical records according to agency, federal and state guidelines. And then for the criteria to facilitate referral to meet needs, here's a bunch of different referrals that I could send someone to in or around Antigo. So like different food pantries, centers, homeless shelters, protective services, AA groups. And then I have the continuum of care, which demonstrates service coordination skills. So like bringing different resources to the client and all those involved in their life, which this is the AA and NA meetings. This also meets that criteria as well. Here's my introduction to the Human Services Timeline. Here is the child welfare workers' response to trauma. I thought that'd be good to have in there for like my future to kind of help out. And then I also have the roadmap for diagnosis because I thought that would be helpful just to like have a reference to look back to. And then I have perspective principles, which I thought would be kind of fun to hang in my office one day. And that completes my portfolio.